Hello, this is Mary. Welcome to the Build Vibrant Health podcast. Today we have Brian Bunn here, and I'm really excited to have him on our podcast. He is the CEO and president of Healthy House Doctors, which is an environmental and naturopathic medical practice. Healthy House Doctors works with patients and clients at getting to the root causes of disease prevention, and the removal of obstacles to cure. They assist their patients and clients to design, mitigate, and assess homes and buildings and help people heal who have lived in or are still living in hazardous or toxic environments. Brian is a naturopath, homeopath, translational and applied scientist, epidemiologist, and environmental health scientist. He has a slew of professional credentials relating to environmental health and sustainability. Some of these include EMF, mold, building design, and more. He weaves all of these together holistically to help people heal and thrive. I'm so incredibly grateful to know Brian on a personal level as well. We met at the Environmental Health Symposium, which is an environmental medical conference, almost 4 years ago to the date, which I find really synchronistic. We discovered that as we were sitting down to record this.
With other synchronicities that you told me about years ago.
Right. Well, so I met Brian. He was one of the first people that I met coming to Phoenix in 2019. And I was looking for something to do the first weekend that I was here and found on Facebook that there was a session open still at the Environmental Health Symposium. And you were literally standing there at the first booth. And we struck up a conversation and have been friends since, but you've also been a huge mentor in my life and have really taught me a lot of what I know about environmental medicine and health. And without you in my life, the trajectory of my health course could have been very different. You've aided tremendously in helping bring my body back into a place of homeostasis and balance.
And helping you heal yourself.
Right.
Yeah, for sure. Thank you.
Thank you. So I'm really excited to have you here just to share more wisdom and knowledge and impart some of that. We're going to cover a little bit about what makes homes healthy, how Brian got into this realm of holistic health, and encompasses so much. That term doesn't even fully cover what you do for work. And so let's dive in. And what led you down this path?
Yeah. So ultimately what led me down this path is just, as a young person, I, was interested in things relating to health, whether it was smoking cigarettes or people that smoke pot, or when I was in college, trying to be heart healthy and eating, like skim milk yogurt and grape nuts. This is, when I was, again, this was a while back, but I thought that was the healthy thing, eating fat-free and eating sugar-free stuff so that I wouldn't get diabetes, and eating low salt. And in some ways, I call it getting got, right? We kind of get got by these various industries that are out there and their marketing campaigns. And so, I was kind of this, the subject of that, right? So I got. I went down these rabbit holes that I probably shouldn't have. And if I had a wise old mentor who understood the whole system, I wouldn't have gone down any of those rabbit holes. So that's how it started for me, was just learning about my own health. And then I was actually, through college and afterwards, I was doing national, international politics and international relations and things like that, on a path of like law, politics, business, etc. But I kept running up against these things that just didn't work in the political realm. And then I would see how for me, I felt like I couldn't help people in the political realm. But I felt like, there was this whole other world of health that, as I was learning for myself, that people were missing and people didn't understand. And I'd have conversations and they'd say, no, it's the opposite of what you're saying. And so I'd go research it, just because I'm a lifelong learner and I tend to research everything, right? And so I finally, decided to go back to school and get my med school prereqs done, a second bachelor's, and do, my double master's graduate education, and then on to medical school, because I wanted to try to help other people. And I felt like the political realm wasn't good. And then I naively and stupidly believed that, if I went into health, public health, and medicine, there would be no politics in it because we could establish what works and what doesn't work, and people would love it, and they would just eat that stuff up. And I didn't realize, the last 3 years have shown us that the politics of medicine and public health are incredible, and they hurt a lot of people. So anyway, full circle, right? That's kind of how I came to be where I am. And yeah.
Wow, so you've had a lot of personal experience as well as professional experience that have led you along this path, like so many people who have gotten involved in the realm of environmental medicine or holistic health. Oftentimes we have a personal story with that. What is your vision for and with Healthy House Doctors?
So my vision for Healthy House Doctors really kind of started with, my study of naturopathic medicine probably 25 years ago. And it was that, 100 years ago, physicians would go into the home. More than that. Physicians were always going into someone's home and seeing the environment that people were in. And I won't get in right now the 6 principles or the principles of naturopathic medicine and other principles, but those principles were hugely inspiring and eye-opening for me. And so I knew that when I really started to implement these ideas, that most of the problems were actually in the home. So, in other words, the home is where the problems reside. It's not that the home itself, because a lot of people that call us up think, oh, how can I make my home healthy? And that's kind of not the right question, or not the best question to ask. But we're, in essence, what we're trying to do is help people to learn and heal so they can realize their full genetic and biologic potential, so they can do whatever it was that they were on this earth to do, right? Their destiny, whatever their calling is, because too many of us, because almost everybody's sick, too many of us have had to spend an inordinate amount of time and money and energy and even social, support and credit to try to solve this issue of people being poisoned. And when we can just stop the poisoning. So the best place to see that is in the home. And for me personally, again, I'm very, very empathic and very emotionally connected. And it hurts me, it pains me deeply to watch so many people being harmed needlessly when the solutions are simple. They're not necessarily easy, but they're simple.
Okay, so let's expand on that a little bit more in terms of what people are, you say people are being poisoned or being harmed in their home, for people who might not be aware of what you're referring to.
Yeah. Well, this gets into maybe I guess a little further down the road, right? Which is what makes a healthy home, or what are the aspects of a healthy home. And it really just depends what we're, really on the person that we're looking at. Are we looking at an individual here? Are we looking at a family? Are we looking at children? Are we looking at pets? Are we looking at a sick person, or do we have multiple sick people living in the home, right, or the building, or working in the building, right? Sometimes it's office situations, right? And really, we can ask the question: what makes a home unhealthy, right? And unfortunately, it's a whole series of bad decisions. It's ignorant choices. It's information without the requisite understanding or experience or meaning or knowledge or wisdom. And when I say that, it's everyone. Like, it's the tradespeople, it's the architects, it's the contractors, the subcontractors, and it's us as individuals and the choices we make to do the cheaper bid, to not deeply understand and research this stuff, or go to the people that have this experience. So, and we can get into in a minute or two what really makes that healthy home. But that's kind of what the challenges are and what makes kind of an unhealthy home. And so we're trying to basically help them in their whole environment clean as much of that up, right? Depending on, and everybody's situation is different. So we want to help them clean that up to whatever the most important things are for them in their specific instance, with their specific health issues, in that specific instant of time within their medical, the context of their medical and health history. Does that make sense?
That makes sense.
So let's take you, for instance, right? When I met you, you told me an incredible story about what you had gone through, and the social dynamics and emotional dynamics of what that meant for you and your relationship and your marriage with your family. And then not even speaking to the physical environment, and then how the assessment was done, and then how the remediation was done, right? All these different things. These are all different components that are, again, different from, from your case, say, to, the 50 to 100 other clients and patients that we deal with. Every situation is unique. So you can comment even a little bit more on some of your experience with that for people.
Right. Well, what you said about each person having their own needs, even within a family, really resonates, because the house that I was living in Michigan, I became so incredibly sick over the course of 2.5 years of living there, whereas my ex-husband at the time was also in the same house living there, and he didn't develop the same symptomology that I did. He did exhibit some health symptoms and was having some heart issues and some like anger, emotional issues. It just became like a very distant person, but how the environment affected his body was so incredibly different in how it affected every single system in my body.
Yeah, it's good that you recognize that, because I will say, medically speaking, we see this all the time where people are like, no, I'm fine. I don't have any health issues, or I may have some health issues, but the rest of my family is fine. And then when we ask questions, because we're trained in this medically and environmentally, right? We ask questions and we find out, no, actually everybody is sick. Everybody is having challenges, but they just don't know how to relate it to their environment. Right?
Well, and also everyone's body leading up into that point, I, looking back, had more environmental exposures and maybe more trauma than he did at the time. Fill in the blank for anyone. It's not about myself and him, but a family that you're working with, even my own family, I grew up in a home that did have water damage, and my sister exhibited a lot of signs of asthma and a lot of severe allergies to things that didn't play a factor, not to the same degree, in my own body.
Yeah. Whenever we're dealing with someone's health issues, right, we call it, like kind of a web of causality. There's myriad things that are causing those health issues, and not just at one point in time, but also throughout the history. So you bring up a really great point, which is that, your medical history, your health history is different even than your sister's, because maybe you went to school here and she went to school there, or you took stuff from the house, and she took, she bought new stuff or whatever, or all these things, all these dynamics are different for every single person, right? And then however, and then different people have different, genetics and different biology and different ecology, right? Even microbiologically, they have a different culture in their gut, and then their whole, the microbial community on and in every square inch of the body. And all of that plays a huge role into what's going to happen for that one person. Or, again, it could be an animal, right? It could be a pet.
It could be pets. And we didn't have any pets in that said home, but actually looking back at my childhood home, we had quite a few animals. One of my favorite dogs growing up was a golden retriever named Sandy, and she was only 4 years old, and she had like a what they said was a rare form of cancer that was really aggressive. And looking back, I mean, animals can absorb a lot of emotions and also energetically, but I do think, looking back, possibly the home could have played a role in her illness.
For sure. And again, this is one of the biggest challenges for vets, right? Or even for doctors, right? Because veterinary education, right, it doesn't include a whole bunch of environmental exposure education. Medical school, I can tell you, I've been to medical school. They teach it a little bit. Actually, where I am in most medical schools, they don't really teach it. And so that education is really either inadequate or it's non-existent. And then even if they teach it, when you get to the clinic, they don't reinforce it in all their cases.
Right.
And even when I worked with different doctors out of their clinics and worked with their patients, they're still thinking in the clinical way of thinking that we've been teaching for over 100 years in the country. So thus, when you go in and get a diagnosis, they're giving you a Latin name, right, for something that's going on in the body. And then they're giving you some kind of drug or supplement or whatever that's been demonstrated to be effective for it, but doesn't really consider what the costs are and isn't really getting to the root causes. And so this is one of the failures of our medical system, and even our public health system, right? And so the challenge is, this is why, again, we created that vision for healthy house doctors, which is that we want to be in the environment so that we can actually look at that whole person in their whole environment, because most of the problems are right there. Now, again, just resolving that doesn't resolve necessarily the infections and other medical issues that have developed for decades, right? It's taken a person, years to walk that path in that forest and get lost and go down the wrong trails or climb up the wrong ledge or get rimmed out or wherever they are, right? It's not always doesn't take as long to get back home again, but we have to kind of know where they've been and where they are to try to get them back to where they need to be.
A lot of people are sick in our society with chronic illness, autoimmune issues, cancer, fill in the blank, overall dis-ease in the body. I don't know the statistics, maybe you do, but the amount of people that are on prescription medications for various ailments. I remember when my grandma passed last year, she was on upwards of 10 plus medications, and that has unfortunately become normal. So what is going on here? What's going on with this chronic disease that we see in our society?
And I don't think you mentioned cardiovascular disease and strokes and
right.
You got Alzheimer's and you got all these dementia aspect, all huge things, right?
Even simple diagnoses like, I don't like to use the word simple, but IBS or fibromyalgia, all of these diagnoses are seemingly so common, but not normal.
They're definitely not normal. And let me say that you spoke to drugs, but I don't think people really understand the risks of things like supplements. And I know you and I spoke about this 3 or 4 years ago when you worked for one of the major supplement companies. And I still wasn't a fan of supplements because we don't know when these things are made, like what they're really made from. Let's say you have an extract of something. We don't know where that's sourced. We don't even know if it actually really has a real, biological medicinal component in it. It may have just been some synthesis in chemistry that has its own problem. We're not going to go into organic chemistry right now, but you make a compound in organic chemistry, and it's not just a simple math equation we write down on the line. It is a complex physics nightmare to try to figure out what's created and how many contaminants and intermediates and unwanted byproducts are in that process just from taking a couple of reagents and making a different product, right? So everything that we have in our society has more and more things in it, right?
Well, not only that, but then the supplements, the additives and fillers and colors, dyes, and everything in addition to that process.
Yep. And again, sourcing. A lot of it's coming from China and other places like that, right? So, but I don't even mean to get into all that. It's just the point is that it's not just the drugs, right? It's that the drugs, at least they have to go through a kind of I think it's more of a dog and pony show, right, with the FDA, where it's kind of a revolving door between those people, right? Between the regulatory authorities and the companies. So it's the companies pay for it and the FDA gets their budget from it, right? So you have these conflicts of interest that don't serve, the little person. But in supplements, they don't have any of that. They don't have to prove anything. That's where the law that was pulled in 1994, the Dietary Supplements Health and Education Act, the DSHEA Act. A lot of us lauded it at the time because we thought, hey, give us access to our supplements. But now it's to the point where the pharmaceutical companies have largely bought out most of the the nutraceuticals. Right. And they're marketing them like crazy and they're associating them with disease and this, that, and the other. But there's no random, and there's problems with random control trials, but there's not even those kinds of things. Anyway.
Which is so wild because I took so many supplements for a good 2.5 years thinking that it was going to be, that was necessary to heal and repair my body from mold illness. And I do think that it helped to a degree, certain things I was doing or taking, but in the long term, it really was more damaging than it was helpful.
And like a lot of our patients, I don't know what you remember or not, but I believe with you, even early on, we told you that, doing these binders, they likely were doing a lot more damage than they were doing help.
So depleting to the body.
Right. And I remember you weren't able and ready to get off of them. At least that's what I think I recall from that. And we see that a lot with a lot of our mold patients, is that they think because they have a little information from the internet or because other people recommend these protocols that they're doing something really great, and that because we're doing something different that, it's we don't know what we're talking about. And that's the danger of everybody, sleeping at a Holiday Inn Express last night, right? Is that everybody's become an expert in everything, but they don't have that knowledge and wisdom and experience, the clinical experience.
Well, it's such a standard process, not the band, no pun intended. It is such a standard process to take binders and
yes. Well, it has been, right?
Certain things specifically for mold and Lyme and that.
And let's be clear, those things will make some of the symptomology go away.
Right, which is why I was so nervous to get off them and why I was hesitant, because I felt better. So I thought I felt better when I was taking binders.
Just like people who have pain might take a painkiller, but what consequences does it have on the body at a cellular level, at a mitochondrial level, from an addiction standpoint?
Right, and I remember ad nauseum you used to tell me that, and I would get so annoyed. Yeah, starting to understand it a little bit better now.
I'm sorry to annoy you, and
it's okay.
And at the same time, it's like we see people go down this path, and we see them get better, but when we remove the obstacles to cure that are in the home, right, or usually that are in these people's space, and hopefully it's something that we can control, that we can rectify. Right. But when we do that, we see people instantaneously overnight transform. And I think if you give me permission to speak about when we brought you out of your really contaminated home, you were like peeing I think 7 to 10 times a night or something like that. And then the first night you came and slept in our yard just to kind of keep you.
Yeah, I camped it.
You were down I think to 1 or 2.
Yep.
Peas a night, and by the second or third day you were down to none.
Yep.
So just by us getting you out of the majority of your contamination, right, we were able to change something physiologically that you could see, right? You wouldn't necessarily know, and I bet none of the doctors were asking you about, your urination frequency. I don't know. Maybe that's
at that point in time, I had given up on seeing conventional medical doctors, because for a good 2.5 years, I was going doctor to doctor almost every single week, sometimes multiple times a week, and them all pretty much telling me that it was anxiety and in my head, or being like, you have IBS or you have early stages of MS, here's some medication to take for that. And I knew deep down that it was not the solution. And then when I moved into more of the holistic naturopathic realm, it was just, here's a list of supplements and herbs that can help you. So by the time that happened, that experience that you're referring to, the only type of modality that I was really doing was something like lymphatic massage once in a while.
Right. So do you know
self-throwing things?
Do you know what disease you actually had at the time? We're not going to give it a Latin name. You had poison person syndrome.
Body.
Right. You had poison person syndrome. You were highly susceptible because of all the poisoning. Your body could not overcome, no matter, and you were eating pretty much organic food, eating a lot of fresh fruits and vegetables, but that's not enough to overcome the poisoning.
Right.
This is the whole thing, in that you get a lot of people in naturopathic medicine that want to micromanage your biochemistry. Biochemistry is infinitely more complex than they teach us in medical school. And I think that they really teach us that so that we can become good drug pushers and supplement pushers. Because the industry then wants to, present all this stuff to us at these conferences. And so we can take that approach, but the problem is that, and again, we kind of have to go back to, the naturopathic principles, right? Which is to first do no harm, right? And try to get to the root cause. But when we're doing these things, we don't necessarily always understand the harm that it's doing. When we start micromanaging someone's biochemistry, right, and that's the tools that we're going to use, let's say even a supplement, right, what effect does that have downstream on biochemistry or another physiology in the body? And as naturopaths, I think I've said this before to you, but, naturopathic medicine is about 85% of the same medical education that they teach in an MD program or a DO program, right? But one of the things that's very different is that we get twice the physiology that the other schools or modalities will teach. They get more drugs and maybe a little bit more in genetics or something like that.
Well, and another really big difference is MDs and NDs. the residency experience is also
For sure.
very different.
For sure. But where I'm going with that is that these things can do so much harm that we don't even fully understand yet. We still have doctors that think that the heart is a pump, right? Because that was the analogy that was given to the heart 400 years ago, right? I'm a student of the history and philosophy of science, and I just find it always so interesting throughout history that we kind of think of the brain as a computer. The brain's not a computer. It's far more complex than that. And the heart is not just a pump, right? In fact, there's theories out there now that the heart is actually being pumped by the movement of blood, that it's not actually doing the pumping. Almost like the peristalsis that goes on, the pumping in your gut, right? In your small intestine and large intestine, right? So my point being is that one of the differences that we have in our medical practice and also in all the environmental stuff is that we want to first do no harm. So we're really careful about what we suggest a person should do because we know that there may be, downside, very significant downside risk to taking a particular approach that we see other doctors doing all the time. So, yeah.
So what I'm hearing you say is a lot of the chronic illness and disease that we're seeing in this world is due to overtoxicity and poisoning of our environments and our bodies and micromanaging our biochemistry. Can you talk a little bit about where the source of disease is coming from?
Yeah, well, there's two really great words that I think are incredible to sum this up that I don't expect your listeners to maybe, be really adept at saying and make it part of their daily language tomorrow or anything. But one of them is the idea of cultural genic disease. And that was a term I think that was coined by Dr. Sidney Rolf-Singer. And he has a medical anthropology background, and I have some medical anthropology background myself. And so we're always, by the way, just what medical anthropology is, that we're looking in food anthropology, nutritional anthropology, we're looking at how human societies, the hundreds of thousands or millions of human societies that have existed from the part of time, and even other primates and other species, how have they done what they've done for hundreds of thousands or millions of years? And how did they get us to today, right? And then how are we doing things today? And is it really in sync with the natural laws of the world, right? The way things actually work? Because we see in various primate species when they live outside those natural laws or they specialize too much down into one area, they actually become extinct, right? So anyway, he introduced this idea of cultural genic disease, right? And I think most people don't know this, and this has been, I think, in the literature for at least the last 25 years or so. But this idea of iatrogenic medicine, and that is, or iatrogenic disease, and that is basically a disease that is caused by our medical system. And it is the number one cause of disease in our society, or I should say the number one cause probably of death, even though some of the statistics try to play a little bit loose with the statistics and say it should be number 2 or number 3, but it's really the number one source of death in our society. And our medical system is actually generating so much disease just through the diagnostics of the disease, right? Going and getting an MRI and having, using contrast, for example, giving you teardrops or something. And I think teardrops just got pulled off the market, 2 major brands, because they were causing blindness in them, right? And I'm sure they didn't disclose to people that, hey, you're going to become blind if you use our products.
Well, I'm sure it said somewhere in the fine print, how many times is there a black box drug warning that has the side effects are exactly the same, if not worse, than what it's claiming.
And a lot of times, because people don't understand the energy of medicine, a lot of times things do cause the very things that they're supposed to treat. And it's different in every human being, right? And it depends on their medical history, on their environmental history, on their nutritional status, all these other things. But anyway, getting back to cultural genic disease, it's the idea that the way our culture is doing things is actually driving a lot of the disease. And there's a huge economic and I would even say a structural component in our society, right? To the fact that our foods are industrial and they're coming from all over the world and they're sprayed with all kinds of chemicals. Even in the organics, right? They're allowed to use certain, approved, organic, chemicals for things, right?
Well, I saw that so clearly when we went to the grocery store yesterday. It was the first time going to the grocery store since being in Hawaii. And it feels so different being in a big city grid and going to the grocery store and seeing pretty much all the food being wrapped in plastic, even the fruits and vegetables, and just seeing certain lifestyle habits of people, and the way that the city is set up, the culture is set up, is it makes it a little bit more challenging to find health and cultivate that here.
For sure. And so under this banner of culture-genic disease, not only do you have the food, right? And you mentioned, because food is in the list of things for culture-genic disease, but,
right.
You mentioned vegetables being wrapped with plastic. That there's a whole aspect to that plastic and what chemicals are embedded in that plastic, what kind of antimicrobials are on that plastic, what that plastic is going to off-gas to the food, right? Or deposit onto the food, what that food might absorb, right? But then there's also the aspect, if you have no plastic, right, you have the people that are touching it with their hands and what that might create, right? I'm just looking at this holistically and just covering a sliver of this, right? But then you also have the jets of the misters and the spray of water. Well, what's in those systems to keep them clean and free of microbes and fungal pathogens, right? And then what of those disinfectants and other chemicals, antimicrobials they put in that are actually getting sprayed all over our fresh organic fruits and vegetables, right? And are being breathed in by sensitive people or injured people who are trying to just walk to the store and get some groceries. Right?
Well, I never thought of that.
Yes, there's some people. We've had numerous patients who are to that extent, right? People that are very, very sick, and there's other people that don't know anything about that, right? But it's not just like food, right? It's also our transportation. It's our airplanes, our cars, our tractors. It's electronic devices and electricity in and of itself, right? But it's also electromagnetic radiation from various devices. It's microbial contamination, which you might hear some people talk about mold, but it's so much more than mold. It's viruses, and it's archaea and fungi and various bacteria, and right. But so we get a situation where we have these damaged buildings. People bring in different furnishings into their buildings. They use different finishes that they go get from the box store. And so ultimately, it's like coming down to how is this home or this building or this neighborhood or this city designed, right? What are the materials? What are the construction? How do they maintain it, right? Even the yards and the landscape, right? And so this affects air quality and water quality and the quality of basically our entire environment. And all these things basically add up, right, to a high level of exposure for people in a home, right? And it's more than that. It's way more than this. But the point is that is what is disease that's being caused by cultural genic factors. And I want to be clear on this. Some of my friends and some of my colleagues and some of my mentors, I've watched go down and get sick and die because even though they were experts in these fields, they didn't really understand the principles well enough, or they didn't apply them well enough, and they went down with the ship. And so this is why, my mentors, even some of them, really made me, promise, right, to get this message out, because this is how we get people healthy, is to really try to address as many of these things as we can.
Yeah, and it can be really overwhelming to hear all of this of like, wow, this is the world that we're living in right now. And I know I felt that coming from the Big Island back to Phoenix. I cried on the plane ride over, and I mean, you've been witness to my up and downs of emotions since being here. I see like what you're talking about, and I feel that in my body of how far we have gotten from really being connected in with the earth. And a lot of our culture is materialistic. A lot of our buildings are sick. A lot of what and I say, like in the United States and other cultures have done, and it can be really overwhelming, but also there are things that we can do to create and cultivate health even within these things that we have created that are obstacles to cure, as you would say. So how do we start to unpeel and unpack some of this so that we can do things within our control to create healthier lives?
Yeah. It's a great question. And again, it gets back to what we were saying before, that it really depends on the circumstances, the environment, and, that person or persons or animal or, whatever it is. How sick are they? We have to do much more for someone who's really sick. We have to be that much more aggressive, and we have to do that many more things for someone who's really sick, because they need radical change right away. Probably because they've either waited too long, or because they had some kind of, systemic shock to their system. Like they were just, let's say they were living in East Palestine, Ohio, right? Those people might be really sick right away, right? It may not just manifest as cancer 20 years down the road. They may be sick like right now, right? So it always depends on that person. And where we start, again, I'm a scientist, right, who has medical training, and again, I'm not a physician, but I have a medical training and work with these, docs, right, and I'm a scientist. So we always start with assessing what the situation is. We have a phrase, like a kind of an aphorism in medicine, that treatment without proper diagnosis is malpractice. And so we always want to start to try to figure out what's going on for that person in their environment, especially as it relates to their disease. We have to know what their disease is, and we have to really know what their health history is, because that's where we really want to start. And I think you and I have talked about this, but our goal in the coming years is to try to have more of a retreat center so that we can get people out of their environments and see how they actually do, like kind of like you did.
Right. Well, that was the biggest.
But it's got to be a healthy place, not just some building, because all these buildings are pretty toxically, built. They're not a place where most people are going to be able to heal, right?
Right. Well, that was the biggest obstacle for me and many people to find a safe place to heal. That's why I met you 4 years ago.
That's why I pulled you out.
It's been a journey back, maybe a lot slower than it had to be, because of that missing healthy building piece.
Right.
So what are some things that you are looking at when you are starting to help someone?
Yeah. So ultimately, we want to get down to asking the best questions that we can. And we find that a lot of our patients and clients over the years have kind of been going down the wrong rabbit holes, and they ask the wrong questions. And I don't want to say wrong, but, they ask the wrong question, and so they get the wrong answers. And several, numerous docs out there, they ask the wrong question, and the trades professionals. And when any of us ask the wrong questions, we get the wrong answers.
Well, give me some examples of what a wrong question would be.
Well, for me, like what we see all the time is, hey, doc, right? And, again, we're working on cases a lot of times together. Sometimes it's just me, sometimes it's just the doc, but a lot of times it's both of us, right? And so it's like, hey, doc, do I have mold? Is mold making me sick? Well, that leads into a rabbit hole sometimes of, okay, well, let's go get you a mold test. Let's go have you do like a Hertz me or an ERMI. And again, I don't want to get into the aspects of these tests right now, but that can lead people down a whole rabbit hole and a whole series of different decisions that ultimately make people sick. Because what we find is that's one of the critical points with a lot of people, is that they get this test, and first of all, the test panics them. It like panics them to within an inch of their life, and then they go call a remediator right away, and the remediator comes over and is going to help them solve all this stuff, and then 15 different decisions that the remediator is going to make is actually more likely to do more harm and potentially make them more sick, while quote unquote addressing the problem, right? And then someone comes in on the backside to test to see if the mold remediation was successful, and it's not really that valid of a test, right? And so the question is not necessarily, do I have mold? Is it making me sick? Or do I have EMF issues? Is EMF making me sick? Or do I have chemical issues in this home? Are they making me sick? The answer, and just for all your viewers, right, or your listeners, right, which is that yes, you do have all those things, and they are making you sick. The question is, to what extent? And which one is the most important to focus on? And we're not going to know that until, again, this is where I said, treatment without proper diagnosis is malpractice. Just because someone knows about something, whether it's a physician or a patient or a client, doesn't mean that that's where we should start first. We want to start first at what is the most significant thing to that person in their whole environment. So, like I said, they have microbial contamination, they have EMF, they have chemicals, it's poisoning your body. You don't have enough nutrition, for most people, right? They don't have enough nutrition to overwhelmingly combat that. That's why they are put on supplements and all this other stuff. And again, I'm not trying to throw the doctors that use supplements, under the bus. I realize it's a huge part of their business practice, and their profits, and they have to make money somewhere. And all this, I totally get that. You realize that this is like a Earth-sized elephant that's like in the room, right? So I get that, right? And I know that for a lot of our patients and clients, this can be overwhelming because we have to figure out what it is in their environment. But again, the solution always is, right? Or if you ask the question, how do you eat an elephant? You do it like anything else, one bite at a time, right? So we have this Earth-sized elephant, but we need to start breaking it down. The solutions are in identifying the problems that are most serious to that person. And so someone can be overwhelmed by that, but that doesn't help them, right? It doesn't help them to get scared by it, right? That's why we try to hold their hand through this process.
Right. But I think it is really common to get scared and to go into this freeze mode. I know that's something that I have experienced around this whole realm. Even just hearing you talk brings up sensations in my own body of knowing what it feels like to be in the position of being really sick and having all of these overwhelming things like mold and EMF and water damage and all of these confounding factors. It can be really overwhelming and stressful to be in that spot. I know when I first got my mold test results back, we had an inspector come out to the home, and I also had some urine mycotoxin results come back. I didn't even talk to anyone right away, but it was just me getting those results that sent me into like a panic mode because, and I talk about this in the first podcast. If you haven't listened to it, it goes a little bit more into my personal story, and so you can jump over there. But essentially, I was thrown into this like freeze, fight, flight state all at the same time. Because I didn't know what to do. I didn't know where to turn for answers. I had these results, but I knew that they could be the thing that helped me return to better health, but I also didn't necessarily know how to get there. And it felt like so much to do all at one time.
Yeah. And again, I know from having worked in a lot of this stuff that the information, when they call up the mold testing places and then they get, some doc, a lot of times they don't book with us, they book with other people because they're cheaper.
Right.
And it's because they haven't invested all the time and education and money and things like that. And
well,
so
there was
the information my point is the information is different from where people are going to get. And I think even when I met you, you were following pretty much a pretty typical kind of functional medicine kind of approach to some of these things. And again, in our practice, we mostly deal with people who've gone down that path, and either they want to avoid that path because they know it's bad, but most people don't. They actually have already gone down that path, and it didn't really help them get back to health.
Or they've gotten to a degree and then they've hit a wall. Plateau.
They plateau, or they even go back a little bit, right? So so we're dealing with people, and then they come to us because they want to take that next step, right? And so that's kind of where we step in, and we're giving them different information. So. We had a family that, to get back to some of these aspects of asking the right question, that had brought us in to test for EMF, right? And I asked about, the health issues of everybody in the family, and they told us everybody's fine except for the wife. She had Lyme disease and, some other stuff, advanced Lyme disease and things like that, and have been working with functional people, functional medicine docs and whatnot. And so they bring me in to test EMF, and then we're sitting there in the living room, and I'm just going through basic health history, and I find out that the husband's been spending more time at home all of a sudden, and he actually has noticed some health changes as I'm asking these questions, which before everybody was fine. And then I start asking more specific questions about the children. The children are also having issues. So now I know there could be an EMF issue. And in fact, again, there is one. There is one in every home, and that we want to fix, right? But it's not a smoking gun. I'm always looking for these type 1 errors, these big smoking guns, and sometimes there's 2 or 3 of them. But sometimes it's little stuff that we can fix when we're right there.
Like what?
Well, let's hold off on that for just a minute. So in this case, right, these people are bringing me in for EMF. I'm sitting there talking to them in their dining room. And right behind the wife's head up on the ceiling is probably a 15-inch stain, right, of water damage. And I said, look, I don't know what that is, but being that where that is in the house, I can tell you right now that that's mold. I can tell you right now that, again, being where it is in the house, it's the second floor. I doubt it's a rodent in the middle of the home, right? So I'm already doing all this analysis, right? It's not probably a rodent who's peeing up on the ceiling. You probably have a water leak, and what's right above this, right? So we're trying to chase all this down, and again, in every situation is different. So we ended up doing EMF tests, and we ended up doing mold tests, right? And we ended up treating her homeopathically, right? Because we always try to do, least invasive type medicine. And, she got better, but we identified the mold issues. We told them, exactly how we were going to try to help set up a remediation. Well, the guy was a do-it-yourselfer. So he just started ripping out walls and everywhere. And
that's a big no.
That's a big no. It's a big no. Sometimes it's okay, by the way. And let me be clear. 10-20% of the time, there's not a problem where we thought it was. So I get all these people that again, they chase down these rabbit holes. I'm just going to get some contractor over, I'm going to open everything up, and I'm like cringing for them because you and I both know that the people that go down, 80%, 90% of the time, that is not only a disaster, that's death waiting to happen. Right. So we want to this is where we want to first do no harm, right? We always want to try to carefully control that whole situation and really, again, try to get rid of the idea that I slept at a Holiday Inn Express last night, so therefore I know what I'm doing, or I can just go to the internet and get some good information.
Yeah, mold,
it's not that simple.
Remediation, EMF, all this environmental.
And I know you wanted to bring up
assessment is never a DIY.
And I know that not never. If someone has immense amounts of experience.
Well, you could do a DIY.
But maybe. I will tell you,
you would still work with professionals, but you would be leading and spearheading most of it.
I write remediation protocols and do this stuff for people, so you've seen that. But most people have no business doing that because they don't understand the implications. Right. And so in this case, right, we were able to help the woman, right? But we also found one of the major sources. And by the way, this was a 3-year-old home, and they had 7 water damage issues in the home in those 3 years. People think, I've got to buy a new house, and that's not really the way to do it. And we haven't really gone into depth about this, but there were 3 different water damage issues in this home before they even took, before they got their certificate of occupancy for the house. That's how bad it was. 4 more water damage issues since. Right, and then they had a huge one here, and you know what it was in this case? It was a subcontractor put like a brick or some kind of piece of rock underneath the elbow, connecting the drain out of the bathtub, and it fell and broke open, so the bathtub was just draining into the ceiling. Yikes. And it was because someone basically was a lazy contractor. And
so you were able to go into the home and start to mitigate these...
Well, I wanted to test first to see how bad it was.
Okay, so you tested first, and then from there were able to start to mitigate some of the issues around EMF.
Well, again, remember, every situation is different. So in this case, right, we wanted to be really careful about what we did for remediation, right? He went and did all this other stuff throughout the home, and in his case was really fortunate there wasn't a bunch of water damage behind those other places. And then when we got the remediation, we created very stringent protocols for how that whole containment system was going to be set up, because every space is different and it has to be set up differently, and it has to be set up very differently if someone's already sick, right? So that we make sure that we're not doing any more harm, right? And you and I could do a whole thing.
We'll have another episode on remediation or inspection.
But so that's an example of where, and now once we solved that, now we can start treating the Lyme disease. And we treated it homeopathically and quite successfully, right? And the kids we also treated homeopathically. The guy was the husband really wasn't into that. He's like a macho bro kind of guy, right? And so he did better just by what was done in the home. And we see this a lot of times where other people are in denial because they don't know what to look for, and they don't necessarily accept this kind of stuff because they can't see it. Now they can accept the idea that television, waves come through the air and then come to antennas and stuff like that, or Wi-Fi, or cellular data signals do. But for the most part, if they don't understand it and they can't see it and they can't really understand how it works, people are skeptical. Right. And so that's why we do test for a lot of things, but I'm always looking for what is the building telling me? What is the person's health history telling me? What diseases do they have? What, what's that background, and what is everybody else dealing with? Because those are the things that are going to tell me what's likely wrong in the home.
Right. And I think it becomes more apparent when you have something visible like a water damage stain, or when you are able to get into a home and do testing, you can see the results directly reflecting issues. That adds a little bit more of tangible proof for people. Whereas I walk into a home and you might get a musty, moldy smell. But if there's not a musty, moldy smell and it looks brand new, like the house that made me sick, it looked brand new. It was super clean inside. There wasn't mold growing up the walls. It's hard sometimes for people to wrap their heads around that. But oftentimes is the big missing link to people's health issues.
So I know that they say around 50 or 60% of microbial contamination is behind the walls. In my experience, it's more like 90-95%. And I would say it's exacerbated by the materials that people build with and that they use in construction and renovation. So that's another aspect of what we're doing with people, is we're trying to help them, choose the right materials on the other side, right? So.
Right, and building materials, and not only healthy building materials, but also the design of those healthy building materials are what is needed to create a healthy home.
Yeah, and again, I want to be clear, right? Healthy house doctors, a lot of times people think of us as being healthy home or healthy house, and that's a part of it. That's just the location where most of these problems are occurring. It's so much bigger than that, right? And I love this discussion in our society now, building back better. They say we're going to build back better. It really scares me what is going to get torn down for us to build back better. But if they would have made me housing czar, for example, in the country, and I know there is no housing czar, and no one's leaving me voicemail messages about serving in the Biden administration, the Trump administration, to be housing czar or anything like that. But if they did, right, in a perfect world, I would literally be probably suggesting we tear down most of the housing stock. A lot of it's old. No, seriously, a lot of it's old. A lot of it's been contaminated numerous times, right? People are making decisions in these homes that, and again, it's so much more than we can cover in an hour or 5 hours, right, even. But so many people have already made so many decisions in each of these homes that we're just trying to make these homes healthier, right? And so if we really want to get back to, what is a healthy home? Well, that depends on the geography, right? The different design of a home is different anywhere in the country, even though the builders will just kind of do cookie cutter versions of the same floor plans in different places, even though that doesn't fit. So we're looking at the geography, right? What's the city like? What's the area within that city, right? The land or the neighborhood.
The climate.
The climate, right? Yeah, for sure, right? What's the house? Like, what's the yard like? Who are the neighbors? And what is the neighbors? How far away from you are they, right? And all their stuff. What the neighbors do affects you. It affects you on your EMF. It affects you on the chemicals, and even their mold stuff can affect your home, very significantly. So, again, I mentioned the yard, the landscaping, but ultimately, right, we're trying to get down to the design, the construction, the maintenance, but again, also, it's the furnishings, it's the finishes, it's the stuff we bring into that home, and it's the history of that home if we're talking about a home that's already established, right, versus actually designing one from scratch, right?
Right, so I'm hearing you say
and
it's...
everything else that we bring inside, yeah.
Right, so I'm hearing you say it's multiple things.
That's right.
All...
That's right.
Condensing, accumulating in one, and we can start by looking at the furnishing and the things that we're bringing into our house, making sure that our home doesn't have major water damage and EMF issues. And if it does, bringing in someone like you to come and see where those problems are and if they're worth investing in and fixing, because it is a financial commitment. For sure. But let me say it slightly differently, which is that, again, a lot of times when people call us, they want to say, do I have a healthy house? Or is my house healthy? Can I get better in this house? And can I get better in this house is a great question, because we have to assess that for that person. But do I have a healthy house? Most people don't have healthy houses, right? Almost none of us do. And that's okay, right? Because there's good room for improvement for all of us. But where I'm going with this is that a lot of people think it's the structure, and they don't realize it's the stuff. It's the way that we live in the house. So again, cultural genetic disease. It's the way our culture does certain things, like how we choose to be on,
electronic devices, right, all around the house and the yard, right? That has an implication on our health, and it could be profound, right?
So basically, we have to identify the problems so that we can solve the problems.
Yeah. Well, that's very well said. I hate to say that I could be, summed up into that simple question, but yeah, that's basically it. And so everybody's got different problems because they bring different things in and have had different things going on in their lives and have had different things going on in and around and within the home and the other homes that they've been, that they brought those problems into their new home.
Right. And so if someone wants to contact you and learn more about what you do and maybe work with you to solve some of those problems, how do they reach you?
Yeah, they can work with us or any of our physicians, and they can reach out to us at healthyhousedoctors.com. It's just all one word, all spelled out, Healthy House Doctors, DOCTORS.com. And then we can make an appointment to discuss either with me if they want to work on the environmental level first, which we usually recommend because we get a lot of people that want to do treatment first, and they treat, and then the problem will go away for a few days or a few weeks, and then it comes back. That's because they haven't gotten to the root causes. So a lot of the medical stuff is just people chasing their tail with supplements and drugs and other things that lead to even more stuff. But even if we try homeopathically, if we get the right remedy, it may still come back in a couple of days because they haven't gotten to the root causes. So ideally, we start environmentally, but if I'm backed up, because sometimes we book out weeks in advance, or I'm in other cities or even in other countries, right? We can have them start maybe with one of the physicians or at least get an intake done and start them there. But yeah, they can reach out to us and they can start with me or with the doc or with both of us together, right?
Cool.
Yeah.
Well, thank you so much, Brian, for taking time out of your day to speak with us today, to impart your wisdom. I hope you found this information insightful and empowering, and I'm really excited to have further conversations with you because we really just scratched the surface. I'd love to dive a little bit more into really what makes a healthy home and go further into building design, and we could go down some mold and EMF rabbit holes and address some common myths and things that are having people go around the circles. And
it's interesting that you say that, yeah, because I always want to be careful, just to add this before we finish, that so many people are chasing their tails because they think if they just go to the internet and they get a little bit more information, or they just that little bit of information, then for them it's an idea, and so then they figure out, okay, what can I do to fill that idea in? And that's where they start getting into trouble, is that they start getting into trying to DIY everything, and sometimes it works out okay, but most of the time it doesn't. And that's when we just cringe for our patients and clients because, again, we don't want them to make things worse, and too often they do. So, yeah. I'm glad you, thanks for having me. And again, just know I learn as much from my patients and clients because they're all so different. And they've all had different experiences. And some of the things that work for a third of them do not work for the other 2/3 of them because it's so complex. But that's what we do. Like, again, we how do you eat an elephant? One bite at a time.
Right. Well, thank you so much for listening and tuning in today. If you liked this podcast, if you found the information valuable, please share with a friend, family member, loved one who may benefit from this information, and subscribe to this channel for more information like it. Have a beautiful day.
And thank you, Mary, for doing this for everybody.
Thank you.
Yeah.